Do I have to do my brain exercises forever? Hi everybody, my name is Dr. Perman. I rehabilitate migraines, concussions, and dizziness. Now, one of the biggest kickbacks I get from my patients is, all right, so you laid out this entire rehabilitation plan. I'm doing these exercises 3, 4, 5, up to 6 times a day. If this works for me, do I have to do these exercises forever to maintain the gains? Well, the short answer is no. Once we have built plasticity in your brain, for the most part, that plasticity is going to remain. Now, there are a number of caveats. One is lifestyle. If we have a poor lifestyle that is going to undo the good plasticity that we built, yes, we can go backwards over time. 2, genetics. If there are any genetic abnormalities that we're fighting against, yes, we might be able to slide a little bit backwards sometimes. And then, of course, traumas. If we have any new traumas, yes, that can set us back as well. But for the most part, as long as there are no lifestyle abnormalities, genetic abnormalities, or new traumas, the gains that we make with our therapies should, for the most part, stick. Now look, that is an ideal world. There are always going to be stressors and traumas and things that are going to potentially set us back. So here are my recommendations for our patients as they enter their later stages of care. So these are our patients who are pretty much stable, they've made a ton of progress, and they want to maintain that progress. There are 2 ways that the patient can go about maintaining their gains. I'll touch on my less favorite one first, and then we'll talk about my favorite one afterwards. The first thing that we can do is just completely stop our exercises. Once you've gotten to that point, you can just stop everything, and if you get to a point where your symptoms start to creep back in, then you're a pro. You get right back to your rehabilitation routine 3, 4, 5 times a day, whatever it is, and you beat that dysfunction back into submission. Not my favorite way to go about it, but totally works for you if that's what you want to do. Now, my preferred way to upkeep your gains is by adding your therapy routine into your normal physical exercise routine. So rather than doing your brain exercises multiple times every day, you're going to add your therapy routine to the beginning and end of whatever physical exercise routine you're already doing. So if you know you're going to be exercising 3 or 4 days a week, I'm going to ask you to begin that exercise session with your brain therapies and then end that exercise session with your brain therapies again. That guarantees that 3, 4 times a week, you're going to at least get a couple sessions in throughout those days. That is usually enough to upkeep the gains that we've made previously with our neurological rehab. Now, one more thing that's really important. Your brain exercises are going to have a maximum benefit, meaning that eventually they're not going to work as much anymore. So that's why it's really important that we check you out periodically to update your exercise routine, create new and challenging exercises for you so that you can continue to push yourself forward, even if you feel like you've gotten as better as you can. This is why once you've stabilized, we recommend checkups periodically, maybe once or twice a year, so that we can get a fresh look at your brain, update your exercise routine, and give you some new lifestyle advice to work on so that you can keep your brain as sharp as possible for the rest of your life.